Hi, my name is Michelle. I'm the vet tech who assisted with all your pet surgeries today. So thank you for choosing Animal Care League, both to help keep your animals safe and healthy, and also for supporting our spay and neuter program, where we are trying to help the overpopulation of animals in the area. So thank you again for choosing us. So I would like to go over a few things with you, just so you know how to take care of your animals in the next couple weeks, and just some important things to look out for following your animal's surgery. So first of all, when you get them home, they may be a little bit drugged still, so just make them go somewhere where they're nice and comfortable, where they can kind of sleep off the rest of their drugs, the anesthesia, and all that. We just want them to be nice and happy right now. So one thing to remember after surgery, if you do have to pick up your animals, be careful how you hold them. So any dogs, female cats, you will want to kind of pick up and make sure to really support their butt, just so they're not dangling down and putting more pressure on their incision. In terms of male cats, you will just want to avoid their rear end. Their incision is on their scrotum area, so we just don't want to hold that because they might be a little bit tender back there. So when you do pick up your animal, just make sure to support their butt so we're not putting extra pressure on that incision. And for any male cats, just make sure to avoid that rear end so they're not too sore. We just want to keep in mind of their incision areas. So you can give them food and water for sure when you get them home. They may not be too hungry at first, but they may be ravished from being fasted. So you can give them about half their normal portion of food. If they eat it, wait a couple hours just to make sure they don't get nauseous, and then you can definitely give them more. I'm sure they will appreciate it. First, a couple things to look out for and be aware of is your animal may be a little bit lethargic, may not quite be themselves, and may not have the greatest appetite for the first 24 to 36 hours. That's all normal. So if you see that, don't be alarmed. If it does go past that point where your animal still isn't himself, herself, we do recommend you take them in to see your vet just to make sure everything is going normally. That's not necessarily something that we would expect to see just from the surgery and what they had today. I would like you to monitor the animal's incision for the next, probably the next week, just to make sure everything's looking good. The incision itself may be a little bit red, maybe a little bit swollen. There may be some bruising in the surrounding area. That is totally normal, so don't be concerned about that. The things I would like you to keep an eye out for is any signs of infection. So the incision itself getting really red, really swollen, that redness and the swelling extending outwards from the incision, and then of course any blood or discharge coming from the area that may suggest an infection. If you suspect your animal's getting an infection in the surgery site, please do go ahead and call your veterinarian and let them know. Sooner an infection is caught, much easier it is to treat, and much happier your animal will be. If you notice your pet is dripping any blood from the incision, or at any point that bleeding becomes excessive, that is deemed an emergency, and you do need to get them to the vet immediately. Although this is not common, all surgeries do have the risk of complications, so I don't want to alarm you, but I want you to know the best way to take care of your pet, heaven forbid a complication does arise. So one thing you'll notice when you are looking at your pet's incision is somewhere in that general area, or if it's a male cat, it will be on their abdomen. You'll notice a small green tattoo. This just shows in its protocol that they are indeed spayed or neutered. We really want to avoid things that are going to stretch the incision area. So usually like stretching the abdomen. So running, jumping, running on stairs are the big ones to avoid. Anybody with dogs, I would recommend to keep them on leash when they go outside, just so you can make sure to control their activity level, but also make sure they're not getting their incision messy. Cats, I would recommend just kind of letting them do their thing. For the first day, however, I would recommend that you keep them somewhere where there's not too many places they can jump that are too high. They may think they're ready, but they still may be a little bit drugged, so we'll want to be aware of that so they don't fall and hurt themselves. If you have a male cat, you will want to make sure that they are able to urinate after surgery. Although not common, it is a complication that can arise from a neuter procedure. So you'll want to make sure your male cat is urinating. If you have other cats at home and you may not be able to tell, it wouldn't hurt just to keep that male separated for one day, just to make sure that everything's running smoothly. Also, anybody who has dogs that happen to go to doggy daycare, doggy day play, you will want to probably keep them home for at least a couple weeks. Same with any cats who go outdoors. Keep them inside for a couple weeks just so we can make sure that their incisions are nicely healed and they're not going to put themselves in any danger or risk of complication. Now, we do need to keep the incision as dry as possible, so no swimming, bathing, grooming. If your cat likes to go in the sink or the tub, keep them away from those areas. And for any dogs, definitely if it's raining, keep their outdoor time to a minimum. We don't want them to be splashing any dirty water into their incision, so beware of that. So pretty much if it's raining, out to do their business and come right back in. You don't have to actively clean your pet's incision, but if you do notice that they lay in urine, they lay in feces, they get something messy on there, you can use hydrogen peroxide to clean the area. Then just make sure to watch out for any possible infections that may arise after that. So check in with your veterinarian if you're concerned. One thing that somebody probably spoke to you about at drop-off would be getting an e-collar for your pet. Now, this is very important in case they do decide to go after the incision. If they are licking or biting their incision anytime, you will want to get that collar on them for their protection. One, so they don't injure the incision site. Two, so the more licking they do, more likely they are that a little infection is going to pop up there. So we want to avoid that as much as possible. If you do purchase a collar for your pet, we want one that is going to go safely around their neck, so with at least 2 fingers between the collar and their neck, and you want to make sure it goes past their nose. If the collar does not go past their nose, they can still get their little tongue around there and they can still lick their incision. So just keep that in mind when purchasing an e-collar. If you do have to put it on, it may not be for too long, just until that licking behavior stops. So all the cats did have 2 pain injections post-surgery, so they're going to do really well with pain management. They usually bounce back very fast. You will be surprised and alarmed, but we do need to still try and keep, especially the females, a little bit calm. The dogs, however, are going to go home with some pain medication. This is an oral pain medication. You shoot it right in their mouth. If they won't allow you to do that, you can just go ahead and put it in their food. For male dogs, they're going to go home with 2 doses. For female dogs, they're going to go home with 3. So you start this the morning following surgery after you give them the breakfast. It does not need to be refrigerated, but you do need to keep it out of direct sun and heat because that can mess with the medication. As long as you keep your animal calm, you keep them dry, clean, and happy, the incision and everything should heal up quite normally. We do recommend that 7 to 10 days after surgery that you do get them checked out with your veterinarian just to kind of have a post-surgery check, make sure everything's looking good. You can ask them any questions. Unfortunately, we're unable to see any follow-up care here, so all that will be done with your veterinarian. So one thing to note, if your animal did receive any vaccinations while they were here, go and take a look at our website, animalcareleague.org, and just there's a vaccine reaction handout. Give that a quick read when you get home, just to make sure that your animal is not experiencing any kind of reaction post-vaccine. Everybody has been great here, but just so you know, anything to look out for once you get them home. If you're concerned, make sure to call your veterinarian. Also, if your animal received a microchip while they were here, we will go ahead and register that for you, and you will have the number and the information. If you do change any of your information, such as your phone number or your address, please make sure to call the company and just let them know so we can keep your animal's information up to date as much as possible. It's also important to have that tag on their collar, just in case somebody does find them. It has their personalized ID as well as the phone number to the company, so anybody can reach out to the company and let them know that somebody has found your animal. If you have any following concerns, we do have all these discharge instructions available on our website, animalcareleague.org, so you can reach out and take a look at that. Also, thank you again for supporting the Animal Care League.